Great, thank you, Zoe. So, we are still enjoying the effects of the vaccine. We really, it's a great opportunity here to continue the great work that we're all doing. Overall, we've had a total of 236 positive cases with 3 active cases, and we're holding steady with 0 resident cases since the month of January. Regrettably, we've had several deaths among our residents, but fortunately, we've only had 6, a total of 6. So overall, I think those results are pretty positive. Next slide. I'm sorry, go back one, please. Here's a breakout of our total cases in 2020, and also a monthly case count for 2021. As you can see, we've had a handful of positive staff cases. We had 5 in February, 1 in March, and 2 in April. And all these were among unvaccinated staff. Next slide. So our vaccine rollout, as I mentioned, has been very successful. Our ultimate goal still remains to get 100%, a vaccination rate of 100% among staff and residents. Thus far, we've vaccinated 84% of our staff. We vaccinated an additional 12 staff members during the month of April, and we're continuing to encourage the remaining 229 staff to get vaccinated. So hopefully, we'll continue to see positive effort as the weeks continue. Next slide. And we're very fortunate to have vaccinated 90% of our residents. We vaccinated an additional 22 in April, and that leaves us only 57 residents who have not been vaccinated. Our annual recertification survey was recently completed. 9 CDPH surveys arrived on April 13th for a 5-day survey. During the exit conference on the 19th of April, the survey team identified 14 preliminary findings. The findings that were identified have already been corrected or are in the process of being corrected. And we will implement the additional changes and submit them in our final plan of correction. Our second survey, our annual life safety survey, was completed on April 29th. 2 surveyors arrived on April 26th for a 4-day survey. This survey was focused on the environment of care, and there were 22 preliminary findings. These findings were all minor. Overall, the performance on both surveys was really successful, and it represented a team effort on the entire part of the Laguna Honda Hospital. So for care experience, the month of May is Mental Health Awareness Month. And needless for me to say, the mental health of all of us has really been challenged during the pandemic. We have been very fortunate to have a psychiatry team here who have been instrumental in helping not only our residents, but they've been very supportive for our staff as well. And here are just a few of the areas where they were instrumental during the survey. So we continue with our plan to reopen safely the hospital. And after such a long period of being in lockdown, of course, it's very rewarding really to be able to expand the services among residents. In addition to reestablishing visitation on all units, so we're doing indoor as well as outdoor visitation. We are also gearing up to expand opportunities for residents to go out and pass. So as you know, commissioners, one of our greatest assets here at Laguna Honda Hospital is our therapeutic farm and gardens. It's really a favorite location among our residents and really our staff as well. You know, the farm was recently profiled in SF Gate, and it was a great story. It really was. It profiled our farm manager and activity therapist, Henry Cortez, and one of our residents, our prominent residents, Felipe Martinez. Here's just a snapshot of admissions and discharges. So we generally average around 12 admissions a month. We had a slight uptick in admissions in April to 15. And we will continue to see an uptick going forward. One of the things that we've done is made a commitment to CSFG to accommodate 4 admissions per week to help them to create additional capacity. So that effort is underway, and hopefully you will see those numbers continue to pick up. On the financial stewardship side, so here's just a summary of our financial update for Q3. We have a surplus in both revenue and expenditures for the quarter. Our finance team is actually right now in the process of gearing up for the year-end close, and they're using this as an opportunity to identify, to reconcile, and to document all of our COVID-related expenses because we will be transferring them to a DPH COVID fund. So for our revenue picture, we show a $12.56 million favorable variance in Medicare and Medi-Cal revenue. And this really was just the result of a higher than expected SNF per diem rate. On the Medicare side, we have a 2.26 unfavorable variance, and this was due primarily to lower than expected outpatient visits and some pharmacy expenses. On the expense side, so we show a combined $8.37 million salary and fringe benefit positive variance. The surplus is a result of, as I mentioned earlier, we've been authorized by DPH to move COVID-related expenses to a centralized DPH COVID fund. So that has created a significant surplus for us. The $300,000 negative variance in non-personnel services is due to higher than expected registry services. And we also have a $2.08 million surplus in materials and supplies, and that is primarily due to COVID cost recovery. And we delayed certain expenses during the pandemic, certain projects that were not essential, and so that created that positive variance. And so at this point, I'm going to hand off to Monica.
Sure. Thank you, Michael. Good afternoon, Commissioner. So similar to what we did last month, I will be bringing you nursing leadership updates as we have transitions and also changes. And so the first person that we have is Maria Chavez-Lagosca. She is moving into the utilization management patient flow nurse manager role. And I just wanted to highlight Maria because she happens to be the nurse leader who's overseeing South 5, which is our COVID unit. And so Maria will be leaving South 5 and transitioning into this role, a role that she's very excited about because she came from us from CSFG, and this is the department that she worked in. So we're very excited to have Maria join the patient flow team. In addition to that, we have Nami Angeles. She's actually being promoted. Nami came to Laguna Honda as a charge nurse and then was quickly seen as a leader here and was given a role as an acting manager. And now she's been given Maria's role as the manager of South 5. And I will tell you, when we made Nami's announcement, she got so many congratulations. People were very excited, even the team on South 5. are happy that she's joining the team.
Excuse me, Monica, is it possible for you to get closer to the mic? You're echoing a little bit. I'm sorry.
Is this better?
Yes, much better. Thank you.
You're welcome. And so I just wanted to say about Nami, you know, she's really an example of promoting within, and she has really demonstrated talent, and I've been very impressed with her focus on quality and patient safety since I've been here at Laguna Honda. Next slide, please, Zoe. So today was a fantastic day here at Laguna Honda. We actually had our Daisy Award celebration. And so we celebrated 4 awardees and 200 nominees today. And we were, Dr. Colfax actually joined us, as well as Mayor Breed sent a great video thanking our team here at Laguna Honda. So we really appreciate the support of our leaders within DPH. And so we had a great celebration, a very nice turnout. And on the screen, you see Kathleen McCarrow. She actually is the CNS that I talked to, the clinical nurse specialist that I talked about last month. She is the Daisy Award coordinator here, and she did a fantastic job leading this work with me. So I just wanted to recognize her in front of the commission so that you all can see who she is and recognize her for her efforts. So I think it was a great day, great celebration, very inspiring for many of us. And so we continue to have our Daisy Awards and our Nurses Week celebrations. Tomorrow we will be having an acknowledgement luncheon for our nurses, which is being led by our nurse leaders, as well as Marvin McGregor, our director, who's been our champion for Nurses Week this year. And so we're just very excited about what's been happening here at Laguna Honda this week, and I'm very happy to share it with the commission. We also recorded the Daisy Awards, and hopefully we'll be able to share that video with you all at some point. I'm going to turn it back over to Michael to see if he has anything he would like to say about the awards today, and then
Great.
just the remainder of this presentation.
Thank you, Monica. Yes, I do have something I want to say about the ceremony. So this was my first Daisy Award ceremony here at Laguna Honda, and I wish you could have been here. It really was a tremendous event. It was very well planned and thought out, and very inclusive, and the team really went to great lengths to get as many nominations as possible and to honor as many people as possible. And I just really want to say that how proud I am of our CNO, Monica, for re-establishing this award, this so important award, even in the pandemic, for us to have this award program. It meant so much to the staff, and so I just really wanted the commissioners to know how impactful this event was. All right, so continuing on, just a couple more slides. So our team of the month, this month, is our facility services team. This is really an extraordinary group of professionals who have been instrumental really in helping us to keep our operations going during the pandemic. The team consists of carpenters, clerical support, electricians, gardeners, locksmiths, painters, plumbers, stationary engineers, and utility workers. And really, in addition to being a highly competent group of technical professionals, they really have also developed a reputation for customer excellence. It's just really amazing how they take their jobs, and you know, how they just have great relations when they are dealing with customers. So just a super team and very well deserving of this reward. And then our final 2 slides are just relating to our continuing work with equity and culture. So we're really getting off to a good start. We recently had our first Equity Council meeting, and that meeting featured representation from all of our departments. And also the department recently published their first equity newsletter. And so, this was the first volume of it. So I think as time goes on, we will really look to utilize this newsletter, to get out great information and resources to the staff. So more to come on the equity newsletter. And also part of what the equity team has been engaged in at the DPH level, we recently had the Derek Chauvin trial, and of course that was really a stressful moment for many of us here at Laguna Honda. And so the DPH equity team sponsored a forum, like a healing forum, and really allowed employees to call in and really to be able to decompress and just to really share some time. Over 300 DPH employees attended that event. And also, there was a similar event that DPH sponsored. It was a racial equity town hall meeting, and it really highlighted our racial equity action plan, that thick document that it really guides our performance and actions in equity. And this event was very well attended as well. Over 560 staff members were in attendance. So more to come on equity, but so far I think we're off to a good start. And with that, we'll pause here and see if we can answer your questions.
Okay, great, and thank you again, Michael, and the executive team for another inspiring report, which I know there's a lot more that goes on there than we get to see in the reports, but this is always just sort of, in some ways, it's a celebration for us as well, to hear all of the great things that are going on there as the work continues. Hopefully, next year we'll have a chance to attend the Daisy Award celebration with you all as well, because it sounds like it was something that it is just a really sort of hospital-wide great event. And also having a chance to see the recognition Team of the Month, the facility service, who often go unheralded. And so I just congratulate you on recognizing them as well. Are there any other questions or comments from commission members?
Commissioner Green has her hand up, Commissioner Guillermo.
Okay, great. Sorry, I don't have my.
Yeah, I would just reinforce what Commissioner Guillermo just said. I don't think we can thank you enough. And I think you as leaders, having worked at other institutions myself, are doing just a stellar job of making staff feel appreciated. And this of all years, I think it's so important because this is the year that our staff has actually risked their lives to take care of patients. And some of the heroic activities that you've witnessed at Laguna Honda, as well as we've witnessed throughout the system among the staff, are remarkable and impressive, and just such an example of incredible dedication. And I certainly feel honored that you're sharing this with us, and just so privileged to be able to learn by your example. And I just congratulate you all for your leadership, and to everyone who's made such a vast contribution to the spirit and the culture at a time when many other institutions have started to really disintegrate. So I just can't thank you enough.
Thank you so much.
Okay, great. Okay, then I think we can move to the next item.
And actually, Commissioner, if I could just quickly jump in, the last line of this presentation, the DPH-wide Racial Equity Town Hall, I just sent all of the commissioners, an email about a future meeting, and I have the link to that town hall. So you all, just FYI, you're able to watch that if you want to.
And actually, I did have a quick question. The equity newsletter that you mentioned, Michael, how often is that going to be coming out?
I'm only guessing here, but I would say we're going to do it at least quarterly.
Okay, it might be nice if we have a chance when it does come out next, if you want to go ahead and include it in the packet so we can get a sense, or have Mark send it to us just so we get a sense of what's being covered in the newsletter?
We certainly will.
Thank you. Okay. So the Regulatory Affairs Report.
Good evening, Commissioners. Can you hear me okay? Oh.
Yep.
Okay. Good evening. I'm going to share with you the Quality Management Regulatory Affairs Report for the month of April. For the month of April, we reported 29 facility-reported incidences to CDPH. No anonymous complaints were shared with us. Of those 29 cases, 28 were allegations of abuse, 1 theft and fiduciary abuse. As Michael shared, we completed both of our recertification surveys. On your report, it says we're awaiting our 2567s. We've actually received those. All information in there is very similar to what we heard in our exit conferences with the surveyors, so that's excellent. The plan of corrections are due on Sunday and Monday, so you'll hear updates on those during our next June JCC meeting. Outside of that, you have the rest of the information in front of you. We have 76 facility reported instances that are pending without request. And I'll open it up to you for any questions or comments.
Okay, thank you. Let's see, I don't see any hands raised. Are there any questions from Dr. Green or Dr. Chow? It's a short report this time, very short.
We had a lot of survey activity in April, which took up our time, so.
Yeah,
and I will give you a proper update on that in June in terms of the breakdown of those findings as well as the corrective action items.
But it's really good to hear that there wasn't anything different in the formal report versus the preliminary findings, and that they seem to be all very correctable items.
Yes, very much so. And actually, there were a few findings from the exit conference that did not make it onto the official 2567, which is wonderful. We love to see that happen.
Yeah. Okay, thank you.
Okay. Of course.
Well, we just moved right along here. Let's see, we have the presentation then to go to. This is something that I think we're all anxious to hear more in detail about. And I know that there's some questions that are going to be answered for Commissioner Green as you make your way through this presentation.
Yes. Yes, good afternoon, Dr. Guillermo, Commissioner Guillermo, I'm sorry. Irene Blanco and I are going to do a presentation on our resident-centered care plan project, and Commissioner Green's questions will be answered in the presentation. And so I'm going to turn it over to Irene and let her start, and then I will end the presentation.
Good afternoon, everyone. Before I start. Okay, great. Just to give you guys some information about our care plan project. For background, Laguna Honda, and actually also with DSFG, prior to our electronic medical record, everything was actually paper. Many of our care plans were homegrown, and we developed them as we need them. In August 2019, we actually implemented DPH-wide our new electronic health record, which is EPIC. The framework for this EPIC here at Laguna Honda actually was acute care content. They are evidence-based. There was very minimal long-term care content. However, these care plans actually were standardized problems, goals, and interventions were in place. This was also a new documentation process, so when we implemented EPIC in August 2019, we actually transitioned the care plan after the implementation date. This actually identifies specific new opportunities for us. We needed to look at our current state of care planning and enhance our staff education, And we also needed to make sure that the content of our care plan actually meets the regulatory requirements for long-term care. 2 months after our implementation, we actually had the state surveyors, or CDPH, came for the regular relicensing survey in November 2019. At that time, actually, it was, I would share myself and a surveyor reviewed our current care planning, and it was a learning point for us that we needed to make sure that we enhance our individualization of the care plans and also identify the gaps. And so that moved forward in our plan of correction, but also this process improvement. Slide. So part of the plan of correction is, as I mentioned, focus on individualized care plans. Our nursing leadership, with the assistance of quality management, we actually created an A3. The surveyors actually receive a first copy of that A3. In that A3, we wanted to refine the nursing process and improve our care plan to be resident-centered. We looked at our current state to validate the gaps that was identified, specifically on re-education. We looked at specific factors such as the acute care structure, and to change them to a long-term care structure. We also looked at the integration of resident-centered care based on our CDPH and CMS requirements. There was set goals and targets looking into our education rollout, and also looking at our error rate of care plans not individualized. We developed countermeasures to look at these items, and then also we conducted PDSA, or Plan, Do, Study, Act, which I will review in the next couple of slides. So for the resident care plan content structure, our plan was to match the content such as goals, problems, goals, and interventions that will match our long-term care needs. One of the things is, as I mentioned, they were acute care templates. We had our CNS group who actually reviewed these contents, and we worked closely with our EPIC super users and our EPIC partners in DPH to see if we can remove or alter or change, revise the content that will assist us in our care planning. One of the things that we actually, an example would be, for example, there's duplicate care plans for one issue. So, for example, there is a care plan for skin integrity, compromised skin integrity, and pressure ulcer injury. So those care plans are actually in individual subsets, and we needed to make sure that they are, because it's one problem, they needed to be in one category. This also required assistance in training our staff to make sure for things to be actually simplified and consolidated. So this process is in progress as we continue to educate our staff and review the EPIC content. Next slide. Regulatory and compliance, the other PDSA that we did was we actually needed to validate our errors or non-individualized care plans. One of our CNS developed a care plan audit, and this was used to track our performance. This was developed on how to do the audit. We trained other CNS or clinical nurse specialists and nurse managers who are our auditors. In this process, we were able to in our study piece, we actually continue to refine the tool and then also be in compliance of our study. The audit process continues to be reviewed and revised as we enhance our consistency and efficiency. We continue to audit until we decrease our error rate, which is less than 15%, and that is in progress. For people in education, we're focused on developing people. Our plan is, and our goal is to enhance nursing competency, specifically focus on what matters for our residents. We created ELM or e-learning modules. There were specific topics that was needed for the plan of correction, such as dementia, medication, safety. However, we also work with our Department of Education department to really look at all of their educational presentations and tools to have individualized care plans. So those were reviewed and changed so that every single year or every time we have a new education, there's individualized care plan in those educational tools. We also collaborated with our EPIC super users to help our staff to learn how to navigate through EPIC. We actually, our goal is to have 80% or greater on this compliance, which we met at 89% as of April 1st. The other piece that we worked on for developing people is measuring the competency of the staff. We are making sure, we want to focus on our...
Erin, sorry, I think that the slides are not matching your presentation. I'm following along on my in my book, but I think the slides are one ahead of what you are actually presenting. So I just wanted to make sure that I wasn't in error there, following the wrong thing.
Did I miss something? Oh, I'm on phase 2.
Right, okay.
Oh, no worries. Okay, phase 2, sorry, let me just make sure I'm on the right place also. Yes, phase 2, so developing people. So we wanted to measure the competency of the staff. Our resident care plan or competency is focused on the licensed nurses. Our clinical nurse specialists provided training to our nursing leadership, which is our nursing director and nurse managers, and to serve as mentors. So one of the things that we actually started to do is develop and implement care plan huddles. When our auditors actually does the audit and they see that there is a care plan that is not individualized, we actually schedule a huddle with the line staff in that unit to review that care plan so that they can see what is missing and what is and how to document a more appropriate care plan. So this has been in process that we started earlier this year. Phase 3, which is also developing people or education. Care planning is an interdisciplinary team approach. We're planning to expand the education to the rest of the resident care team, such as rehab, social worker, nutrition. We want to be able to create that education and integrate this to the care team meetings. Based on our study, we want to be able to complete this as 80% or greater, identify any measures that needs to be captured and planned. And so this is in the planning stage, and we're working with specific leaders of those areas. And then Monica, sure.
Thank you, Irene. I just want to recognize Irene for the work that she's done around the care planning project, as well as the CNS who has helped, and also Quality who has partnered with us on the care plans. So this data is data that you've seen as a result of our performance improvement plan, and I'll describe it a little bit. So the top slide is what the expectation was March 2020 to July 2020. And the expectation was for the resident care teams and the CNS to do 6 audits per care team, which is a total of what you see 76 here. As you can see, there was some challenges with completing those audits. So a decision was made in August of 2020 to reduce the number of audits necessary. And when I say audits, it's what Irene discussed earlier, where the CNS has created an audit sheet for the CNS and nurse managers to go in to make sure that the care plans are complete and include all the components that we were required to have within the care plan. So as you see, when the number of audits went down, things improved, and February of 2021 and March of 2021, they've been able to meet the goal. One of the questions I had when I came to Laguna Honda is what was the challenge with them being able to complete the audit? And the answer that I got was the audit was too intensive and took too much time. So the nurse managers were telling me that the audits took 2 to 3 hours of their time to complete one audit. So I sat down with a member of our EPIC team and the CNS, and I actually went through the audit process about a month ago. It did take a lot of time, not necessarily 2 hours, but what we did find is that there is an easier way for them to do the audits and get the information. So we are planning to have an education with the managers and the CNS to go through the easier way to do the audit, so we can then increase the amount of audits that they're doing and make sure that they're covering all the components. I will say that as I review some of the care plans myself, there are opportunities with really matching the resident's needs to the care plan. So for example, if a resident is a fall risk, some of our nurses are used to just putting general things about what to do if somebody has fall risk and not specifying the information for that particular resident. So our focus really is on education and educating the nurses on how to appropriately do a proper care plan. Next slide. So we will continue with our monthly resident care plan audits, but also work with quality to see if we need to redefine what the audits look like to make sure that we're measuring exactly what we need to be to make sure that the assessments are completed correctly. We will be doing competencies, as Irene said, with the licensed nurses to make sure that they understand what an individualized care plan is. That was a little bit of the deficit that I found when I was doing my assessment as well, is what is an individualized care plan and what does it look like? We will continue with the RCP huddles with frontline staff and then explore opportunities to work with multidisciplinary care planning efforts. And as Irene mentioned, with social work, dietary, and other areas to make sure that the care plan is inclusive of all areas that the resident needs to have focused. The other thing that we're going to be looking at, and this was actually an idea that was brought to us by the clinical nurse specialist, is we're going to look at participating in the Age-Friendly Health System project. This is a project that is led by IHI, the Institute for Healthcare Improvement, and it looks at the 4 M's. And the 4 M's for residents are what matters to them, their medication, their mentation, and their mobility. And so by teaching our staff those things and really how to focus on those areas, we can help improve the overall lives of our residents. The other thing that we have here at Laguna Honda that we have not necessarily been using is called NICH, and it's the Nurses Improving Care for Health System for Elders. We actually pay annually to belong to NICH. What NICH does is provide evidence-based practice modules for training and teaching of nurses as to how to implement evidence-based practice to care for our residents. So we're going to be implementing the NICH education modules as part of our Department of Education so that nurses understand the interventions necessary that are based on evidence-based practice. And they will be able to then implement that in the care plan. So there are a lot of things that we're working on to improve our care plans here at Laguna Honda. I know a lot of work has been done. We have a lot of work to do, but really it's about educating the staff, and that's what we're going to spend the next few months on, is really educating them on how to appropriately write an individualized care plan. Thank you.
And commissioners, there is somebody on the public comment line. Is it okay, Commissioner Guillermo, if I check with that person?
Yes, please. Yes.
Person on the line, if you'd like to make public comment, please press *3 to raise your hand so we can recognize you. Again, *3 to make public comment on item 6, the resident-centered care plan project. All right, I don't see a hand, commissioners.
Okay, great. Thank you, Monica and Irene, for the presentation and for all of the new information that we're getting about how this project is progressing and now and for the foreseeable future. Looks like continued challenges, but you're getting a good handle on what needs to be addressed. I see Commissioner Chow has his hand up.
Thank you, and I would also join in thanking you for the presentation on this very important topic, which certainly has come back time and time again. And initially, the challenge seemed to have been related to EPIC, and you described that very well. It's an acute care system, and so I had just several questions, but so one. Is EPIC being very responsive? It sounds like they are, and it would be really nice to understand that they are helping with creating the module that you all need. Then I guess secondly, you're using an 80% level for competency, and I'm wondering if this is sort of your initial goal, but do you have an end goal of something higher? Because it would sound like we want the competency of well, what this would say is that 20 plans are not really matching what we would like to consider as resident care planning. So I'd like to know how we established, or you've established, that 80% would be your initial goal. And thirdly, in terms of and understanding why you had to change the, I would say, your benchmark and your goals initially for the audits per year. The numbers that you would be auditing if we continued at that pace would take about 3 years to get to everybody's care plan. So what is your objective as an endpoint? And I really want to thank you for this, and I would suggest that we keep this topic as a regular report back, because the resident care plans are really very important. And you can work this out in terms of the time, it may be every half year or whatever it is, in order to understand your progress and challenges and celebrate your wins. So and I'm sorry, did not get Commissioner Green's comments. So if any of these were duplicative of hers, I apologize.
They were not. Irene, do you want to start?
Yes.
And I'll add.
Yes, Commissioner Chow. For the first question regarding EPIC, yes, EPIC has been very responsive in assisting us. They do have to prioritize a number of projects because EPIC does, it is DPH-wide, and with the COVID plans or activities that's happening, there's a number of new builds that's happened. However, we do have EPIC, we're fortunate to have EPIC super user here on site. These are our team of nurses that actually have been trained by EPIC, and if there are small changes that we can make, that we can coordinate as minor builds, those are done. A good example is such as for the interdisciplinary team, a lot of our nurses actually requested that they wanted to see care plans of other disciplines. And so EPIC was able to actually create a load all button, that's what it's called, and that will allow the nurses to actually see care plans of other disciplines. And the EPIC super users internally also create message boards and guidelines or tip sheets that whenever we see that there may be a gap of education, we actually send that out regularly. So that actually has been helpful.
So to answer your question, Commissioner Chow, about the 80%, so you're right on. We started as a initial goal at 80%, but our goal for everything is really 100%. But we want to start it at 80% so we can recognize when a team does get to 80%, and that will give them the motivation to see that they can do it, with a goal of actually getting to 100%. So you were right, it's the initial goal. And as far as the number of care plans, it's a little difficult to explain how care plans are in Epic. So when we say care plan for a resident, we're not talking about one care plan. A resident, based on their individualized needs, can have 25 care plans. So from February 2020 to December 2020, 280 resident care plans were audited. Not per resident, but care plans for resident. And so there were 3,754 care plans, an average of 13 care plans per resident. And then the error rate for non-individualized care plans was 42%. So for that time period, when you looked at all those care plans, 42% had non-individualized care plans. So I wanted to clarify that. And you're right, when we come back and present again on our success, we'll be able to bring you the numbers for the second half of the year, and we can tell you they will be much improved.
Thank you. And thank you for clarifying that we're really talking about a whole series of care plans per resident. Because at first it sounded like we were talking about, you know, the resident care plan. And so I'm wondering, as you're looking and doing your work, and it's really much more complex than when I first read it, would you be identifying the errors, or I should say the problems in certain departments that had certain care plans so that these also would be corrected? And I guess a final question would be, is there any way to really relieve you all of multiple care plans of this nature, or to simplify it so that there could be much more concentration? This obviously is very time consuming on patient care.
That's a good question.
Yeah.
I'm going to start with the Epic part.
So with the Epic, the functionality, it is challenging. I want to acknowledge that. It actually requires a nurse to edit the care plan, like load it all into one area, like another side of the screen, and then actually edit it to update it with the current problems and current goals and intervention. So that has been actually our gap or room for improvement that we've been trying to train our staff to be able to simplify those specific problems or care plans. The other piece is really the education, is really the clinical and critical thinking piece of, yes, I have 3 different wounds. However, I only need one care plan for those 3 different wounds. So that is one of the education that we've already identified as a gap that we're trying to re-educate our staff.
And I asked the same question when I started my role here, Commissioner Chow. So we're still working on that, but what I'll say is that, to Irene's point, we have to educate the staff on how to do the care plans. But as far as the audits are concerned, we did find a way to minimize the amount of time that they will be taking to do those audits, and we're planning to do that education upcoming. And so hopefully it will save them time. Really the goal is to get to a point where we don't have to do these audits at all anymore. So when we do reach that 100% mark, or the benchmark that we decide, and it's consistent, we can then retire doing the audit. So to your point, the managers can spend their time really supporting their teams as opposed to doing audits. That's one of their concerns as well.
So this just led me to ask you a final question, which is really patient related. As you're doing these audits, do you feel that you are finding deficiencies or gaps, or in fact you're pleased with the overall care plan that has been produced? And do we know, you know, obviously it can't be 100%, but you have a feeling that we're not missing anything, and that this is kind of more a validation of the work that Laguna is doing?
So part of the audit, actually, after completing the audit, the expectation from our auditors is have the actual staff assigned to that patient update the care plan. That is part of our education process. And also, we've implemented our care plan huddles, as I mentioned earlier, to really discuss the care plan as a case study. And so that everybody can look at, sort of understand the process of why certain interventions or goals are identified, but they're not documented in the care plan.
And so to answer your question, the care plans have been much improved. I've heard that they've improved tremendously. However, it's still an opportunity that we have to work on. It was identified in our most recent survey that we need to continue to individualize our care plans more effectively. So we will be continuing to work on those. But from what I'm told, from what they were a year ago till now, they've improved tremendously. So the team has done a lot of work.
Well, thank you very much, and I've learned a lot more about care plans and your project, the complexities of it, and I'm sure we all look forward to the results of these work, or the progress, I should say, and an ultimate result that sounds like it's leading to even better patient care. So thank you.
Thank you.
Thank you, Commissioner Chow.
Thank you also, and I would agree with Commissioner Chow that it would, and I know we ask these questions about the care plans at every meeting because it comes up in the reports in terms of the audit, but to have this sort of as a separate item to be sort of more regularly updated now that you are actually doing the A3, I think would be really helpful. Because as you can tell, it's an area of sort of education for ourselves as well. So in our responsibility as the JCC, I think you're seeing that this is something that we really want to pay much more attention to, not just in terms of the process, but also in terms of the outcomes relative to patient care. So thank you very much for the work that you're doing, and we do appreciate how challenging and how sort of singular I think this is with regard to the industry. So appreciate it very much.
Thank you.
Thank you.
Okay. Great. Any other questions before they quickly take their seats? Okay. Okay, great. I think, Mark, is that the end of our agenda or
Of the open session? And so we're at a place where a motion for closed session would be appropriate.
Okay, is there a motion for a closed session?
So moved. Yeah, and I'll second.
We'll do a roll call vote. Commissioner Chow?
Yes.
Commissioner Green?
Yes.
And Commissioner Guillermo?
Yes.
Okay, great. Please give me a few seconds to switch us over. And person on the public comment line, you will not be privy to the discussions in closed session. You can stay on the line, and we'll be back after the closed session. Okay, we are back in open session, and commissioners, a consideration of whether to disclose or not disclose.
Move not to disclose.
Second that.
Roll call vote. Commissioner Guillermo? You say it again?
Yes.
Okay. Commissioner Chow?
Yes.
And Commissioner Green?
Yes.
Great. And then a consideration, unless you have other comments, a consideration for adjournment.
Nobody wants to adjourn?
You too much.
Well, I was waiting for comments, but I didn't want to cut anybody off. I move for adjournment.
Second.
All right, we'll do a roll call vote. Commissioner Guillermo?
Yes.
Commissioner Green?
Yes.
And Commissioner Chow?
Yes.
All right, thank you, Laguna Honda staff, for the great meeting and
Thank you
wonderful.
all. Have a great week. Okay.